Okay, well, welcome to everyone, and I'd like to welcome everybody to today's meeting of the El Paso County Public Health Board of Health. And I'll go ahead and call the meeting to order, and we'll do roll call first. Obviously, I'm present. Doris Ralston,
Present.
Commissioner Geithner.
Here.
All right, and Commissioner Nelson.
Here.
Okay, I see you there. So you guys are together. Very good. We got the two commissioners in. Oh, no problem. And Hunter Barnett.
I'm here.
All right, good to see you, Hunter. Dr. Chan.
I'm here.
Okay, good afternoon, Dr. Chan. I see Todd Dixon here, but Todd?
Present.
All right, thank you. Courtney Salt?
Here.
Okay, good to see you today. And Dr. Vu. And Dr. Vu is the only one I don't see online, so hopefully he will join us as we're doing our introductions. So next thing on our agenda is simply the approval of the agenda, and I would ask for a motion and a second for that.
Doris Ralston, I move to approve the agenda.
Okay.
Mayor Todd Dixon, I'll move second.
All right. All those in favor, please say aye.
Aye.
Any opposed? Okay, so the agenda is approved. And on the agenda, the next item is Board of Health comments, but really it's some introductions for our three new members. And rather than me reading about our new members, what I think I'd like to do is just have us introduce ourselves, and I'll start, and then perhaps we'll go with those in the room, and then we'll go online. And I'm the board president, Dave Donaldson. I'm city councilman. I was appointed by the Board of Commissioners to represent District 1. Served on the board since 2021. I had a background in the military. In my second half of my career, I was a physician assistant in the Army, and then did medicine after the Army also. Also serve on the board of Colorado Springs Utilities. I'm the chair of that board. And again, like I said, represent District 1. So very pleased to be the president here. And with that, I'll hand it off to the vice president, Doris Ralston.
Well, I'm the most senior member of the Board of Health here. I think I'm in my 7th year, and in the winter, I'll be starting my 8th year. And I work for the Colorado Springs Osteopathic Foundation, a nonprofit philanthropic foundation that awards grants to health-related nonprofits in El Paso and Teller counties, and scholarships to osteopathic medical students who are from Colorado with the hopes they'll return and practice medicine after they complete their residencies and/or fellowships. And I have a background in school and community health education and a master's in public administration.
All right, thank you, Doris. And we'll go to Mayor Todd Dixon now.
Okay, I'm Todd Dixon. I'm Mayor of Green Mountain Falls, Colorado. I've been my second term. I'm a degreed electrical engineer and spent most of my career in the aviation industry, first with Boeing Military Aircraft, then was Learjet, and then from there I went into the Federal Aviation Administration. Last 11 years of my career, I had the certification office for Colorado, Utah, Wyoming, and Montana. And I retired with my wife in 2020 and immediately became a planning commissioner, and then from there became mayor. So that's a quick summary.
Yep. Thank you, Mayor Dixon, and welcome to the Board of Health. And now we'll go to Courtney Salt.
My name is Courtney Salt. I'm here representing just the citizens at large. I have a background working for various nonprofits and in policy work, but I'm happy to be here and serve. Thanks.
All right. Thank you, Courtney. And now we'll go online and we'll start with our two county commissioners.
Hi, I'm Lauren Nelson. I was just appointed County Commissioner for District 5 in June, and on Tuesday of this week, we voted to establish that I would be the representative for the Board of Health, and I look forward to serving on this in this group. I have a background in food science and nutrition with a focus on food safety and food science, and for the last several years, I've been serving on the Colorado Springs District 11 School Board, and as I said, I'm excited to be here.
And I am Carrie Geithner. I am the commissioner for District 2 and also the chair of the Board of County Commissioners. And, I don't My background is varied. I've been everything from a high school teacher to owning a small business, working in the nonprofit space, doing development. I founded a charter school and continue to preside over that school. I think I'm in my 6th or 7th year, so lots of different things.
All right, and welcome to our two county commissioners. And I think we'll go next to Dr. Chan.
My name is Deborah Chan, and I spent most of my working career in clinical medicine, mostly in women's health. I worked in private practice as well as previously worked in Indian Health and the U.S. Army on active duty. Mid-career, I decided to pursue an interest in public health, and I went back, got my MPH, and then I worked primarily in international health, in crisis management, as well as in relief and development, and then did a little bit of work stateside with insurance interests. I'm now retired, so I have plenty of time to serve on the board. I want to welcome the new members.
All right, thank you, Dr. Chan. And next up, Hunter Barnett.
I'll bring us home. Hunter Barnett, welcome to all the new members. I recently joined, I guess not too recently ago, about 6 months ago in December. And I live on the north side of town. I work for United Health Group on a strategy and innovation team. Was previously at DaVita Kidney Care up in Denver, so pretty extensive healthcare background, which I bring to this public health board, which has been a lot of fun. And what else? Came out here for school, went to CU Boulder before it was a football school, and continued my education at Kellogg, where I earned my MBA, and just enjoyed being on the board. And again, welcome to all the new people.
All right, thank you, Hunter. I don't see Dr. Vu yet online. I've texted him to see if he can join us today, but we'll see. Man, he may not be able to make it. With that, we'll move on to item number 4 on the agenda, which is public comment for items not on the agenda. Amanda, do we have anybody that's signed up, called in, anything? Okay, so we have no public comments. And with that, we'll move to item number 5, which is the executive session. And our county attorney, Nate Whitney, will lead us into executive session.
Thank you, Board President. So item 5 is executive session pursuant to CRS subsections 24-6, 402, 4B, and F for a conference with the county attorney's office for the purpose of receiving legal advice on specific legal questions pertaining to the recruitment and hiring of a public health director, and to discuss personnel matters not specific to any individual employee concerning the recruitment and hiring of a public health director. And to go into executive session, we do need a vote of the board, 2/3 to approve, so I would turn the floor back to you, Mr. President, for that vote.
Okay. And so what we'll do is we'll just go down our roll and just simply, if you would like to go into, or you agree to go into closed executive session, just please signify by saying aye. So
Do we need a motion?
Yes, I think Robert's rules technically, if we get the motion second and then.
So okay, thank you. I would ask for a motion to enter executive session, closed executive session.
Mayor Dixon also move.
Okay, thank you.
Second the motion.
All right, so we have a motion by Mayor Dixon and a second by Doris Ralston on the floor. We need a roll call, though, correct, or do we just do it by voice?
I think either's fine so long as we get 2/3 of the vote.
Okay, well, I think we need a roll call. So aye for the president. Doris Ralston.
Aye.
Commissioner Geithner.
Aye.
Commissioner Nelson.
Aye.
Hunter Barnett.
Aye.
Dr. Chan.
Aye.
Mayor Dixon.
Aye.
And Courtney Salt.
Aye.
Okay, so that is unanimous.
Thank you, Mr. President. If we just take a break, we're going to switch to a separate feed that is not public for the closed executive session, and I should get the thumbs up from our technical staff
Okay.
when that happens.
About how long do you think there, Amanda? 5 minutes, 10 minutes?
Probably just 5.
Okay, we're on a break for 5 minutes.
Could you just clarify what those of us are online need to do, what we should be looking for?
That's,
Do we need to click on a separate link, or what do we need to do?
Well, they should be doing